All right, Dr. Fauci, thank you so much for your time. This is Josh in Tampa, Florida. We're short on time, so I'll just jump right in. I want to start first with Florida. I'm not going to take time to rattle off all the stats because I assume you know them, but I do want to know your assessment here. Why us? Why now are we seeing what we are here in Florida? And how do we stack up in your assessment to everyone else right now?
Well, you're having a very difficult situation because of the low level of vaccination that you have, not only in Florida, but some of the other states. Florida is really one of the worst in the sense of the number of new cases and now the number of hospitalizations. As we've said often, that this is fundamentally an outbreak, a pandemic of the unvaccinated. And given the relative lower level of vaccinations in Florida compared to some of the other states, you're much more vulnerable in Florida. You have, over the past week, you have about an 84% increase in cases and about 110% increase in hospitalization. That's really bad news. I mean, obviously, you don't want to see that, but that's going on. It's a very, very difficult situation. You're dealing with a very formidable virus, one that transmits very readily from person to person. And you don't want to get people infected and you don't want to get people hospitalized. And the best way to counter that is by getting vaccinated, vaccinating as many people as you possibly can. And in situations in which people aren't vaccinated, particularly in indoor settings, they should be wearing masks. Masks is a good way to protect if you are not vaccinated. And even if you are vaccinated, it can add an increased level of protection.
Does it have anything at all to do with a seasonal pattern, as been suggested many times by some of our state leadership?
No, that's just not the case. We've seen that so many times in the past. We now have a year and a half and more experience with this. We have global experiences in countries that have their winter and our summer and their winter. And this is a virus that really doesn't know much about seasons. Now, obviously, outdoors is much better than indoors in the sense of transmission of a respiratory virus. It's much safer to do things outdoors. But when you have very hot weather and people go inside with air conditions, that kind of obviates the outdoor aspect of that. So we are not seeing something that we could say, well, this is just seasonal, it's going to go away. This is summer, it's bad. We're going to go into the fall, and it could be bad in the fall unless we get more people vaccinated.
It is the first day of school here for much of Tampa Bay, Dr. Fauci, and we've operated for a while now, as we've learned more about kids and COVID, that at least initially, they were largely spared by any severe illness. It seemed at worst they were potential vectors to spread it. Has Delta changed that risk to children? I know that we're seeing a greater volume of kids getting infected, but are they getting more sick now?
We don't yet have the full studies, the observational studies of children and the severity of illness, but all you need to do, which is we've done, is to go to some representative children's hospitals throughout the country, particularly in those areas where there is severely hit with additional cases and additional hospitalizations. And virtually all of the pediatricians, the hospitalists, are telling you that you're having more children and the children appear to be sicker. So we know now from some studies, some observational studies from different countries, particularly a rather good study from Canada, that indicates that in addition to spreading much more efficiently, it appears that it makes disease more severe by the increase in hospitalizations that they're seeing at any age, not only children, but at any age.
Does it particularly worry you, the rate of hospitalization, pediatric hospitalization here in Florida?
Well, it does. I mean, I'm quite concerned. I mean, we want to protect everyone, but particularly vulnerable children who don't have the opportunity to get vaccinated because the vaccines are not yet available for children 12 years old and younger. But we're also seeing a low level of vaccination among adolescents and others, kids 12 to 18, who are able to get vaccinated. Their vaccination rate is really quite low. The vaccination rate for the entire state of Florida is below where we'd like it to be. There's a solution to this problem. And the solution is getting as many people vaccinated as quickly as you possibly can.
Well, on vaccines, what is the timeline right now to get approval for younger kids as we do start school again?
Well, we're actually well into the studies, not only the NIH, but also the pharmaceutical companies, either alone or in collaboration with us, in doing what's called age de-escalation studies, looking at kids from 11 to 9, and then from 9 to 6, then from 6 to 2 years, and then from 6 months to 2 years. We're well into the study. We're getting data regarding the safety and the immunogenicity. Ultimately, because this is children, this is going to be a regulatory decision. And the FDA will have to decide independently, because you don't want to interfere with the judgment of the FDA. They're an independent group that does things so that you have confidence in the regulatory process. When that's going to be able to be given to kids at that age is really going to be a regulatory decision.
Is there any goal in mind when you'd like to see this done?
Well, I would like to see it obviously as quickly as you possibly can, because we want to protect the children. You can protect the children by vaccinating those who are eligible to be vaccinated, who are surrounding the children, such as teachers and personnel in the school, as well as any child that's also eligible. But for the children who are not eligible yet, you can protect them by surrounding them with people who are vaccinated so as not to spread, but also to enforce mask wearing as recommended by the CDC.
Well, you bring up masks. Superintendents and school board members risk having their salaries withheld by the state of Florida if they do mandate masks in our districts here. What do you say to Governor DeSantis if you're sitting across from the table from him about that?
Well, I'm not going to say anything directly to Governor DeSantis because he doesn't ask me, and he obviously has a campaign against me, as you well know, with his T-shirts and his mug. So I'm not going to get involved with Governor DeSantis, except to say that it is public health. Doesn't make sense when you're trying to do everything you can to protect children to do something that would interfere with the protection of the children. So, and no matter where you are, whether you're in Florida or any other place, from a public health standpoint, that's not an appropriate thing to do. You should do everything you can to protect the health of everyone, including and particularly the children.
I want to move to cruise ships because there's been a big battle here in our state over the vaccine passports, specifically when it comes to cruise ships. There was actually a preliminary ruling issued this weekend by a judge essentially saying that Florida cannot stand in the way of cruise lines if they do want to require proof of vaccination. But I wonder, is there a way to sail right now without requiring vaccination?
You know, I don't want to get into the specific of the details because I haven't examined that very carefully. But let me just tell you how I feel that we need to get people vaccinated. It would be wonderful if voluntarily they got vaccinated. But I think at the local level, what we are going to see, particularly when we get to the point of the full approval by the FDA of the vaccines, that there will be local mandates. There will be mandates in universities and colleges and places of business, and perhaps even with cruise ships. We've got to get people vaccinated. We're dealing with a public health crisis, the likes of which we have not seen in over 100 years, dating back to the now historic pandemic of influenza of 1918. This is serious business. It's a public health situation that we've got to approach with public health measures and keep any kind of political or ideological issues out of this.
How soon before we get full FDA approval, do you think?
You know, I can't predict it because that's an independent decision on the part of the FDA, but I would hope, I'm not predicting, but I hope that that's going to be within the next couple of weeks.
And do you think that that might help with some of the issues we're seeing with vaccine hesitancy to actually have full approval?
Well, I think we're going to see two things when you get full approval. You're going to see those people who actually in good faith are saying, I really want to wait until it's fully approved, even though we have overwhelming data already and have had for some time as to the safety and the efficacy of these vaccines. But there will be some people who understandably will say, I want to wait. When you get full approval, I think those people will step forward and get vaccinated. But what you will also see is that you will see empowerment of people at the local level to feel much more comfortable in mandating in a private situation, be it a university, be it a college, be it a place of business, to say, if you want to participate in the enterprise here, you've got to get vaccinated. I think you're going to see a lot more of that.
And with back to school on my mind here right now, do you think that teachers should be among those being mandated to get vaccinated?
I think anything that we can do to protect the health of the children and getting teachers vaccinated will clearly be a part of, not the only thing, but a part of the safety of the children I would feel very comfortable with mandating teachers to get vaccinated.
We've been talking a lot about vaccinated versus unvaccinated in terms of, you have a much higher risk, obviously, of severe disease if you're unvaccinated. But what about the unvaccinated but previously infected group of people? What does the data show us here when it comes to protection against reinfection if you've just simply already had COVID here at some point over the past year?
Well, if you've had COVID with the Alpha variant, that you can feel pretty good that you'd be protected against reinfection with the Alpha variant. The problem with previous infection is that it doesn't necessarily have the breadth of protection against new variants, including Delta. And we've seen in other countries and other places, including here, that people actually can get reinfected. Obviously, there's some degree of protection from previous infection, but there's a study that's very, very clear that shows that if you are previously infected and recover and get vaccinated, the degree of response you get is very, very powerful, so that you could feel really quite well protected if you get vaccination following recovery from an actual infection. In fact, the protection is even higher than 2 doses of vaccine to the uninfected person. So the protection is very high. So if you want a really good fundamental background of protection, getting vaccinated after getting infected would be a very powerful tool.
I know the argument always is, and in some cases, correct me if I'm wrong, I mean, natural immunity can provide a pretty robust amount of protection with some viruses, but that does vary virus to virus, right?
It does. But see, you've got to make sure you explain, if a virus doesn't change, like measles changes very, very little. So if you get infected with measles, that's the reason why you get almost lifelong protection against measles, because you don't have a lot of different variants of measles. We're dealing with a virus that has mutated and shown us already that it can give and form different variants. We're dealing with a very formidable variant now, in that it has a very extraordinary capability of transmitting readily and efficiently from person to person. That is a real problem. And if you're protected against one variant, you may not necessarily be protected against another. And that's one of the reasons why when people don't want to get vaccinated, they're not only putting themselves at risk, they're allowing the virus to freely circulate in the community. And when you allow the virus to do that, it's very well known in virology that viruses that don't circulate don't mutate. And if you allow it to freely circulate, you give it ample opportunity to mutate. We're fortunate in this country that our vaccines that we are distributing work really quite well against the Delta variant, particularly when you're talking about hospitalization and death. It protects really quite well against that. But if you get a variant that occurs because there's so much virus circulating around, and that variant eludes the protection of the vaccine, then an unvaccinated person, by not getting vaccinated, not only is putting themselves at risk and their family and their community, but they may also be a vehicle for the production and the evolution of a variant that eludes vaccines, which would then be detrimental even to the people who have been vaccinated.
So then where would a booster shot come into play here? Because there's been a lot of discussion lately about that and when we might find out if we'd need one and who exactly would need one.
Well, we're actually working on that right now. We're following it in real time. We're looking at people who've received the full component of the vaccinations and following them week to week and month to month in different cohorts. And when their level of protection gets to below a certain level, you will be seeing there will be recommendations for boosters. But at this particular time, we're not there yet, but this could change because we're following it very carefully.
But is that contingent, if you say that the vaccines are still very effective against the Delta variant, is that somewhat contingent then on further mutations of this virus?
Well, that's a different story. Right now,
okay.
we're talking about, because Delta is quite dominant. It's 93% of all of the isolates in this country are Delta.
Are you worried, though, about what could be down the pike here beyond Delta? I've heard Gamma, Lambda.
Yeah, well, I actually just explained that to you. My concern is that if you have a situation where you allow the virus to freely circulate because a lot of people are not getting vaccinated, there's always the danger of another variant that might elude the vaccine, which is the reason why the best way you can do to prevent the emergence of new variants is to get as many people vaccinated as quickly as you possibly can.
If we continue on the current path we're at right now in terms of vaccination, do you foresee that that's a pretty likely scenario then that could play out over the next 6 to 12 months?
I can't say likely or not. I would say it certainly is possible.
Okay.